ad antrum. So this Otitis entrance to the mastoid antrum, and this is the mastoid, the antrum, and the mastoid ear cells develop here, which is the inferior aspect of the mastoid cavity. So you have the mastoid, the Otitis, and the antrum and the Otitis ad antrum, the attic, which is the superior part of the middle ear cavity itself, and the eustachian tube. The middle ear proper, or the tympanic cavity, can be further subdivided into the epitympanum, the mesotympanum, and the hypotympanum, as you can see. Alrighty? The eustachian tube connects the middle ear to the back of the nose. In the adult, it is slanted at about 45 degrees downwards and goes medial, 30 degrees downwards and medial about 45 degrees. In the child, it's almost horizontal. And this has implication because in the child, it is easy to see if a child is laying down and drinking, it is conceivable that material can go into the middle ear from the nasopharynx if you have some amount of regurgitation. The eustachian tube, well, it equalizes pressure on both sides of the tympanic membrane. That's its main function. Secondary function would be to protect the middle ear as well as to allow for drainage of liquid. But the main function is equalizing pressure on both sides, the atmospheric pressure with the middle ear pressure. Remembering that the middle ear cleft is actually not in direct communication with the outer world. So on one side of the tympanic membrane, you have the ambient condition. The middle ear is isolated, safe and apart from the fact that the eustachian tube is there, which gives you some communication. For you to hear properly, you have to have equal pressure on both sides of the tympanic membrane. Now, I'd mentioned earlier that otitis media can be classified really as, suppurative. Oh gosh. Right, sorry about that. Suppurative or non-suppurative. But today we're talking about suppurative acute and non-suppurative acute, okay? Now, understand that otitis media is an umbrella which encompasses chronic as well as acute condition. Mr. Adriano Bailey.
Yes, sir.
You wanted to comment or ask a question?
It's Adriano. Are you hearing me?
I'm not hearing you.
All right.
Or Adriano Bailey is a male, female?
Male. Are you hearing me now?
Yes, I'm hearing you now. Go ahead.
I just want to point out that there's a lot of wind in the background. It's kind of making it difficult for me to hear. I'm not sure if there's anything that can be done.
Are you hearing the windy thing now?
No, not now.
All right, good. Maybe add a fan in the vicinity. So I'm just moving it a little bit.
All right,
Is that right now?
Yeah, man, perfect.
Are you hearing better?
Perfect.
Good. I hope that you were able to hear at least some of what I said previously.
Just a little.
Shall I go on or you want me to start over?
No, man, continue.
Okay, good. All right. Otitis media acute. Otitis media defined by convention as a process in which the middle ear cleft shows signs and symptoms of acute inflammation. So acute otitis media suggests infection. Although both are acute or can be acute, we usually reserve acute otitis media for the infectious situation where there's infection in the middle ear or the middle ear cleft. Whereas otitis media with effusion, usually there's really no infection. There's Some amount is liquid and probably some amount of inflammation, but without infection. Okay? The chronic situation, you will get a lecture separately on chronic otitis media. Suffice to say, you have chronic serous otitis media, and you have chronic suppurative otitis media. And that is where in chronic suppurative otitis media, there is perforation, as well as there are two types, tubotympanic disease, as well as atticoantral disease, which again, you will get a lecture on that, I'm sure, sooner or later. Well, what are the risk factors in getting otitis media? Well, a number of factors. There are patient factors and environmental factors. Patient factors include prematurity, a young child, early onset of, if you have early onset infection, the tendency is for you to get more infection. Family history of problems, ethnicity, altered state of immunity, as well as abnormality, craniofacial abnormality, and neuromuscular diseases, as well as allergy. As far as environment is concerned, allergy is closely related to environment, of course, because reaction to environmental conditions sometimes bring about allergy. Daycare, it is said that contributes to otitis media and otitis media diffusion, low socioeconomic status, tobacco and pollutant exposure, and I mentioned earlier about feeding and sleeping on a supine, which will allow material getting down the eustachian tube, and as well as fall and winter season tend to promote problems. We do not have that type of seasonal variation in the Caribbean, certainly not in Jamaica. So that is not a major factor. But suffice to say, you are not being taught for just Jamaica, because some of you, I'm sure, will someday leave to other areas that have these seasonal variation. Incidence of otitis media, it is thought that it is estimated that 80% of children will have at least one episode of otitis media diffusion by age 10. A majority of these occur between the age of 6 months to 4 years. One of the most common hospital admission in the UK is otitis media, acute otitis media. So it is not very uncommon in temperate as well as temperate climate. In Jamaica, the prevalence of otitis media diffusion in a 5 to 7 year group is about 2%, which is a study that was done by myself, Dr. Ashman, and Lynn, and some other individuals from North America. And this was published some years ago, probably about to 1990, 91. Acute otitis media, well, it's said that in the US, about 70% of all children experience one or more attack of acute otitis media by the second birthday. Again, racial variation. Boys tend to have this problem more commonly than girls, and the peak incidence in acute otitis media is similar, but there's slight variation. It's 3 months to 18 months, and children 6 to 11 appears particularly susceptible to acute otitis media. Right. Now, how does one get otitis media, whether it be OEM, otitis media diffusion, or acute otitis media? Well, it appears that the function of the eustachian tube is particularly important, because when that tube doesn't equalize its pressure, there are a lot of changes that occur in the middle ear, which predisposes one to getting this problem. But the vast majority of these things will be triggered by a viral infection. I'm sure almost all of you will have had a cold, and during the time that you're having a cold or upper respiratory tract infection, a viral infection, your ear feels blocked or feels stuffy, and cold goes away, and as time goes on, you recover. Or for those with allergy problems, the congestion in the nose usually result in a feeling of fullness in the ear or popping in the ear. Now, these are basically mild cases of otitis media, and particularly otitis media with diffusion or acute otitis media of a viral origin. Now, what usually happens, well, you can have material going from the nasopharynx up the eustachian tube as well. Bacteria that colonizes the nasopharynx, as well as reflux material. Now, when the eustachian tube doesn't work properly, what happens is that there's congestion with negative, you'll have oxygen, nitrogen, and carbon dioxide, the main gases in the middle ear. Because if the tube is not functioning, then what happens is that the tube is not functioning or because of obstruction. What happens is it is thought that the gases gets absorbed. Nitrogen gets absorbed, then oxygen. With absorption of gases, what you have is a cavity, a closed cavity that becomes negative in pressure because the gases have been absorbed. So no longer is the middle ear equalizing the pressure on either side of the eardrum, but the middle ear now becomes a negative environment in terms of pressure compared to the outside. That negative pressure exerts force on the tympanic membrane, which results in transudation and exudation of liquid into the middle ear, which is highly proteinaceous. Now, there are two things that can happen. You can have resolution, that it goes on to be normal again, and you feel comfortable, as in the case with a viral infection. Or you may have a situation where the problem of the resolution of the pressure in the middle ear does not occur, and you have liquid in the middle ear that is now susceptible to invasion of bacteria. When bacteria gets into the middle ear, there's proliferation, and you develop an acute otitis media. That is one way of this thing, that pathogenesis or the pathophysiology of this thing occurring. So you have response, you have phagocytosis, inflammatory process going on, and the middle ear becomes quite inflamed with dilatation of blood vessels and stasis, you have proliferation of bacteria. Now, eustachian tube malfunction may arise from other means as well, because kids with adenoidal problems can get eustachian tube dysfunction. If the adenoids are enlarged, and if you remember, the adenoids are in the back of the nose, actually in the vicinity of the eustachian tube, whereas the eustachian tube opens on the posterior lateral wall, the lateral wall of the nasopharynx. The posterior wall fully is where the adenoidal tissues are. If that adenoidal tissue proliferates, it can conceivably impinge on the opening of the eustachian tube, resulting in obstruction. Now, other things that can cause obstruction of the eustachian tube include nasopharyngeal carcinoma. And in fact, if any patients between the age of 12 to 16 who presents to you with a unilateral otitis media with effusion, or somebody in their 40s, 50s present to you with otitis media effusion, the first thing that should come to your mind would be a nasopharyngeal carcinoma. Okay? And persistent will drive you to that area. If it's just a cold that they had, then you will maybe want to see. But once there's persistence, if this thing goes on for more than 2 weeks, you may have to look to investigate what's going on in nasopharynx. Have a look or send a person to see an ENT person for them to have a look. Palatal defect can cause eustachian tube not opening properly. And of course, allergic rhinitis. Chronic sinusitis, chronic tonsillitis may contribute to eustachian tube dysfunction, which will give you otitis media with effusion. Increased secretions, one of the slides I projected earlier mentioned that if you have increased secretions, increased secretions, not because of negative pressure, but because of allergens can occur, adenoviruses, as well as unresolved. If you have an otitis media, media with effusion that is unresolved, then it's conceivable that you may go on to get an acute otitis media. The material becomes infected. Viruses causing acute otitis media, well, respiratory syncytial virus, adenoviruses, influenza, and rhinoviruses. Most of these things will be causing common cold, upper respiratory tract infection. And I suspect now with the coronavirus I suspect as time goes on, that may be added to the viruses that may result in acute viral otitis media. In neonates, E. coli, Enterococcus, and group B, strep pyogenes may be involved. But by and large, most of the other cases that you'll see will be from Streptococcus, Haemophilus influenza, and Varicella. Sorry, somebody, wanted to comment? Anyway, so these are the more common microbacteria that will cause an otitis media, acute otitis media. Again, this in acute otitis media, these are the relative, these are the relative proportions of microorganisms that will result in acute otitis media. Well, just like anything else, clinically, history varies with age, but constant feature manifests otitis media. It's really, patients will come to you because of irritability. Sorry, there's just a second. Right. Yeah. Irritability, feeding difficulties may be the only indication of a septic focus in a newborn, somebody in neonatal period. History varies with age. Sorry. Right. 1 second. Most of the symptoms will come under irritability, earache, popping, ear tugging, hearing loss for those for the older ones, imbalance, and occasional temperature elevation. In otitis media effusion, in acute otitis media, temperature may be markedly elevated. In otitis media effusion, delayed speech is one of the problems that you'll have to encounter, because whereas acute otitis media is manifest overtly, otitis media diffusion is usually insidious and does not take on the type of acute appearance, or as it says, or the dramatic appearance as acute otitis media. In fact, if you compare both of them, in otitis media, acute otitis media, where eustachian tube is not working well, then symptoms become overt. With bulging tympanic membrane, you may see child may be have an elevated temperature, probably over 104, the COVID temperature that they're talking about, or, really, really irritable, really febrile, very ill, very uncomfortable, and will be having a lot of pain. Whereas in otitis media fusion, the eardrum may look a little different. It may have liquid in the middle ear, but the signs and symptoms